Hello friends, welcome to today's class. Today we'll be dealing with the topic of stress management. Before we go over to the topic, let us try to revise something which we must already know. What is stress? Let us try to define stress. Stress can be defined as the physiological or psychological strain or tension generated by a wide variety of physical, social, economic or emotional factors which we find it difficult to manage or endure. There are certain aspects which we already know about stress. That stress is an almost continuous and unavoidable part of our daily life. Secondly, we also know that a significant component of stress, that is distress, has a lot of hazardous consequences on our physical and psychological health. So what do? Do we stay as passive organisms, allowing stress to do anything that it wants on us? No. We as human beings are active organisms, and therefore we make active efforts to cope with and manage stress. Stress management involves a number of techniques, modes and therapies that are used by individuals to manage the stress that they endure and reduce it so that they can live more fulfilling lives both physically as well as psychologically. Now that we know what stress management is, we have to understand that there are several models of stress management that have been proposed by a number of researchers. But in today's class, we'll be dealing with two major models of stress management. The first is the transactional model of stress. This was put forward by Richard Lazarus and Susan Folkman in 1984, and it sees stress as an imbalance between the demands of the environmental situation and the personal resources, either physiological or psychological, that an individual possesses. Now, since they believe that the experience of stress is dependent more on the individual's subjective appraisal of the stress situation rather than the stress in itself, they believe that stress management techniques should focus on increasing the individual's coping resources, either skills or material resources or capabilities, so that the individual can deal with the stressor in ways that are more confident and more constructive. A second model of stress is the health realization or the innate health model of stress. It holds that stress experienced does not entirely depend on the stressor, but still it has some differences with the transactional model. While the transactional model focuses on the individual's appraisal of the stressor based on his personal coping resources, the innate health model of stress focuses only on the thought processes of the individual that influence his perception and response to stressful events. They therefore contend that stress management techniques should focus on analyzing the individual's patterns of thoughts. What kind of thoughts does he think of? What are the patterns that he engages in, and what are the consequences of the same? These techniques should help an individual understand the negative patterns of thought that he engages in, analyze these patterns, break these patterns, and induce positive and constructive patterns of thought so that he may see the stressful situation as a challenging rather than a taxing experience. However, in spite of the existence of such models, psychologists today take an eclectic approach, which is in fact an advantageous approach taking into account the good points of all the models that are in existence. Now that we know what stress management is and the different models of stress management, today we shall have a look at some important stress management techniques. The first of these is relaxation, something which you must have engaged in many a times when you were stressed, or something which others might have told you to do when you were experiencing some kind of stress. Well, relaxation is one of the simplest and the easiest and perhaps the most widely used of stress management techniques. In fact, it has been used from time immemorial, and there are evidences that even Hebrews, Egyptians and Tibetans used some form of chanting or breathing exercises for relaxation. However, recent uses of relaxation trace back to a recently developed and popular model of relaxation, that is Jacobson's method of progressive relaxation. During the process of progressive relaxation, the patient is first made to understand the rationale behind the procedure. This is that the tension that an individual experiences across stressful situations can be traced back to the physical state of his body, that is tense muscles. In this process, the individual is made to recline in a chair with eyes closed and made to inhale deeply as also exhale deeply. After this, the individual focuses his attention on specific muscle groups and focuses on alternatingly tensing and relaxing these muscle groups. This process might begin with the feet and the leg and move up to the torso, to the head, the shoulder, the arms, and later the hands. During the relaxation, the person is also encouraged to think about something positive, such as the good feelings that arise out of the relaxation. Further, patients can rate their level of relaxation on a scale of 1 to 10, and they can also raise their index finger to signal the psychotherapist if they feel increasing amounts of pain and anxiety. The rationale behind this procedure is that the alternating tensing and relaxing of the muscles makes the person aware of what a tensing sensation of the muscles consists of, and this is something that individuals experience in stressful situations. Further, he also learns to alternate this feeling of tension with relaxation, which he can adopt in stressful situations. After some amount of training, that is 6 to 8 weeks of training program, or probably 10 sessions of training with the psychotherapist, individuals can handle such forms of relaxation on their own. And if they still feel that it is difficult, they can seek the assistance of audio tapes that are available. These audio tapes consist of pre-recorded voice instructions recorded by the psychotherapist. Another frequently used relaxation technique is guided imagery, and this shares both certain similarities as also certain differences with mindfulness meditation. In guided imagery, the patients are encouraged to conjure up a pleasant, peaceful, calm and tranquil image. For instance, the voice of waves repeatedly hitting the seashore, or a beautiful meadow, or a beautiful scenery, or a waterfall, and so on. The rationale behind using such a technique is that psychologists believe that when a person focuses his or her attention on some particular thing, he cannot focus his attention on any other thing at the moment. And so, focusing on such pleasant images during a stressful situation will help in diverting the individual's attention from the pain, anxiety or uneasiness that the stressful situation consists of, and in the process will help in reducing his levels of stress. Apart from guided imagery and relaxation, there are also other techniques that are used by psychotherapists. These include meditation, mindfulness meditation, hypnotic-induced meditation, biofeedback-induced meditation, and so on. In the recent past, psychologists have started using the eclectic approach, which combines elements from all these relaxation techniques so as to bring forward a more effective stress management technique for individuals experiencing stress. Now let us evaluate the effectiveness of relaxation as a method of stress management. Research evidence has revealed that relaxation is a potent mechanism for reducing a host of stress-related disorders such as hypertension, increased heart rate, blood pressure, muscle tension, low back pain, as also depression. Relaxation techniques such as progressive muscle relaxation have shown a great efficacy in dealing with both psychological problems such as depression and anxiety, as also a host of physiological and cardiovascular disorders. Some of the important cardiovascular disorders that have been dealt with relaxation include tension and migraine headaches. However, relaxation has not shown a complete or absolute efficacy in dealing with pain management because patients suffering from tension headaches have shown only a 50% reduction in pain with the use of relaxation. Relaxation is also an essential first step in other stress management techniques such as biofeedback-induced relaxation or hypnotic-induced relaxation. Moreover, it has shown equal efficacy to biofeedback-induced relaxation in the reduction of tension headaches. Existing studies on guided imagery show a great effectiveness in dealing with a host of problems such as childbirth pain and anxiety, discomfort resulting from treatments such as chemotherapy for cancer, as also the pain and anxiety involved in surgical procedures, especially for children. It has also been found to reduce the discomfort arising from other surgical procedures as also severe burns. Further, guided imagery has also been found to be superior to the much publicized biofeedback mechanisms in decreasing migraine headaches. Now we come to a second stress management technique that we are going to learn about today, and that is meditation. Meditation or meditative relaxation is a quite frequently used stress management technique across cultures, and it involves a practice of encouraging the individual to focus on a single thought, word or sensation so that such a focus will help him in eliminating other distractive thoughts, feelings and sensations, especially those which are negative. Now, meditation has its roots in a number of religious and cultural practices, especially from India and Eastern countries. However, what we must remember is that the kind of meditation which psychotherapists practice does not have its rooting in any such kind of religious frameworks. It consists of only psychological procedures and is often referred to as a cognitive behavioral technique. One of the most widely used meditation technique within the psychotherapeutic framework is that developed by cardiologist Herbert Benson. Cardiologist Herbert Benson developed the Bensonian relaxation or the relaxation response, which combines muscle relaxation with a comfortable position, a passive atmosphere, a quiet and peaceful environment in which the individual is encouraged to repeat a repetitive sound, for instance, one or om or any other sound. The rationale is that when the individual repeats this sound again and again, it helps in sustaining the muscle relaxation, as also helps him from being distracted by other thoughts and sensations. Another type of meditation is the mindfulness meditation, which has its roots in Buddhist tradition and philosophy and is a quite ancient practice. Now, this is in some ways a stark opposite of the usual meditation practice which I described just now. Instead of encouraging the individual to focus on a single thought or word or sensation and blocking out all other distracting thoughts, mindfulness meditation asks an individual to concentrate on all his thought processes, pleasant or unpleasant, negative or positive, and concentrate on it in a way that it comes. However, these thoughts are not just focused as we do in our daily lives. The difference is that the individual focuses on his thoughts in an unbiased, objective and dispassionate manner, like a third person viewing his own thoughts. Such an objective analysis of one's own thoughts reveals the kind of negative thoughts or discrepancies or the faulty manner of our perceptions of environmental situations, our own subjective attitudes, feelings and ambitions that actually modulate our experiences and appraisal of general life situations. Such a dispassionate observation will further encourage us to correct these incorrect and negative patterns of thinking whenever they arise, stop them from coming into our conscious awareness, and replace them with positive and constructive thought mechanisms. Let us now again go on to evaluate meditation as a stress management technique. Research evidence reveals that meditation has shown great efficacy in dealing with a wide range of problems such as stress, pain and anxiety. A great effect of meditation as a potent stress management technique has been seen in the cases of patients suffering from chronic pain. Not only has it been effective in reducing the amount of pain that has been suffered, also it has proven to be more effective than other antibiotic and analgesic medications. Further, patients suffering from chronic pain who use meditation as a stress management technique report to be taking lesser medication and also report an elevation in moods, a reduction in depression and anxiety, and an increase in feelings of self-worth and self-efficacy and a greater level of activity. Meditation-based stress management techniques have also shown efficacy in a wide range of psychological problems, especially anxiety disorders such as generalized anxiety disorder and panic disorder with or without agoraphobia. One major thing that we need to keep in mind while analyzing the efficacy of meditation is that as compared to the other stress management techniques, this is a very cost-effective and simple technique which can be used in our daily lives. Now we come to the third stress management technique that we are going to discuss today, and this is the relatively recent but very popular mechanism of biofeedback. Biofeedback involves a provision of information back to the organisms about the status of his or her own physiological functioning. The wide development in the field of biofeedback and the extensive research that has been conducted in the field has revealed that certain physiological processes, for instance heart rate or digestive secretions or the expansion and contraction of the blood vessels, can actually be controlled by the organisms themselves. And it must be noted that till the development of biofeedback mechanisms, it was believed that these physiological processes are beyond our voluntary control and are autonomic processes. Early experiments in the field of biofeedback were conducted by Neil J. Miller in 1969, and in his experiment on rats and dogs, he found that their visceral responses could be modulated in desired directions through the use of reinforcement. Further experiments such as that by Joseph Kamiya and Barbara Brown not only validated Miller's findings, but they also revealed that human beings are capable of controlling their brain waves, especially when they are given information regarding the same through electroencephalogram or EEG readings. Today, a host of biofeedback mechanisms exist for regulating a number of biological processes, for instance heart rate, skin temperature and conductance, digestive secretions, the contraction and expansion of the blood vessels, gastric motility and others. What does biofeedback involve? Let us go by the definition of Damasio and Martin. According to them, biofeedback consists of an electromagnetic device that emits some sort of signal. Either it may be a sound, a light, or some kind of a buzzer of varying intensity to feed back to the individual information about the state of his physiological functioning. Thus, the individual gains information about the functioning of his own physical systems, which again gives him an opportunity to voluntarily alter or control these physiological indexes, which is not possible if he doesn't have any information regarding their functioning. Usually the information that is fed back in a biofeedback mechanism consists of information regarding the functioning of the skeletal muscles or the functioning of the parasympathetic and sympathetic nervous system. Electromyographs or EMGs are generally used for biofeedback in most clinical settings, and they tend to measure the activity of the skeletal muscles. This is done by measuring the electrical conductivity or the electrical activity in the muscles. Generally, in a state of tension, the electrical activity in the muscles increases, and in a state of relaxation, this electrical activity decreases. And EMG recordings are obtained by attaching electrodes to the surface of the skin over the muscle groups, the state of which need to be measured. Another frequently used biofeedback mechanism consists of thermal biofeedback. Thermal biofeedback is based on the principle that the individual's skin temperature varies with the amount of stress that he or she experiences. When an individual is experiencing high amounts of stress, generally it results in a constriction of the blood vessels, resulting in a cool skin temperature on the surface of the skin. Whereas when an individual is experiencing a state of relaxation, the blood vessels dilate, resulting in a warmer skin tone. Now, the thermistor or the temperature register, which is used in thermal biofeedback, attaches itself to the skin surface, most often on the extremities, that is mostly on the fingers and less often on the toes. This is because these extremities are the most distal points where changes in temperature can be easily noted. The thermistor indicates the changes in skin temperature either by auditory or visual means, which gives the information to the individual regarding what his skin temperature is, and it gives him an opportunity to control it and voluntarily change it, with the most common aim being to increase his skin temperature or reach levels of relaxation. The greatest effectivity of biofeedback techniques is seen in dealing with patients suffering from tension and migraine headaches, as also those with low back pain. And in these fields, biofeedback mechanism has shown a greater efficacy as compared to placebo treatment. However, the efficacy of biofeedback mechanisms in dealing with hypertensive patients is still questionable because conclusive evidence regarding the same is still lacking. Thermal biofeedback, as a rule, generally involves attempts to raise the skin temperature and involves attempts at vasodilation, and hence it is most useful in treating patients with migraine as also those with Raynaud's disease, where the disease involves a constriction of the blood vessels in the fingers and in the toes. However, there are certain downsides of biofeedback treatment as well. The use of biofeedback treatment requires the use of a trained therapist, as also expensive and complicated procedures and equipment. This kind of cost as well as expertise that is needed for the application of biofeedback techniques also requires that the efficacy of this technique be much more than other techniques. However, research evidence has not given any conclusive results regarding the same. Further, the widespread use of biofeedback is still lacking due to the prohibitive characteristics that I just explained now, and it is mostly used in combination with other techniques, which makes it difficult to ascertain the efficacy of biofeedback as a singular stress management technique. Now we come to a fourth stress management technique, that is physical activity. Physical activity and exercise is perhaps the simplest and the most usable of all stress management techniques. Physical activity and exercise has a number of advantages in dealing with both stressful situations and their adverse consequences. Physical activity not only leads to a greater level of health and fitness, but also leads to lower levels of anxiety. A greater level of health and a lower level of anxiety would automatically make you more capable of dealing with stressful situations and appraising those situations as less threatening and harmful. Further, exercise also increases the heart rate and cardiovascular activity, thus providing a potent mechanism for discharging the physiological arousal that arises out of stress. We all know of the tremendous impact of physical activity in dealing with a host of cardiovascular problems and regulating the cardiovascular functioning of the individual, such as heart rate, blood pressure, and other facets of cardiovascular activity. Apart from this, it also leads to a number of benefits in the form of reducing the chances of other diseases. Thus, when physical activity and exercise reduces the chances of physical illnesses, it also correspondingly reduces the chance of stress that arises out of physical illness. Now we come to the last stress management technique that we are going to learn today, and this is stress inoculation training. Cognitive techniques towards stress management believe that it is the cognitive appraisal of a stressful situation that is more important in the stress experience than the stressor in itself. Stress inoculation training is in fact a slightly different technique of stress management. Dennis Turk and Donald Meichenbaum and their associates developed a technique for cognitive pain management, and later Meichenbaum and his associates such as Roy Cameron transferred this technique to the field of stress management. The stress inoculation training, as the name suggests, functions in the form of vaccination or immunization. It believes that if an individual is cognitively prepared to deal with a stressful situation, he is likely to appraise the situation as less threatening and also will be more confident and more capable of dealing with a stressful situation. Thus, by inducing a weaker dose of a pathogen, just like we do in immunization programs, and which in the stressful situation would refer to the stressor, this program tries to inoculate the individual towards the experience of stress, especially higher levels of pain, anxiety, and distress. The process of stress inoculation involves 3 stages. The first stage is the stage of conceptualization. In this stage, the psychotherapist works closely with the individual to understand his or her stress experience, what are the difficulties he faces, and what are the various aspects of the stressors that he is facing. After such an analysis comes the second stage, the stage of skill acquisition and rehearsal. In this stage, the individual concentrates on acquiring and rehearsing those skills that will help him deal effectively with a potential stressful situation. This may include learning skills such as relaxation and desensitization for reducing stress, or it may even involve learning practical skills, for instance, how to deal with others such as social skills in case of persons for whom interaction in the society creates a great deal of stress, or assertiveness training for docile individuals who feel that they are dominated a lot by others and this becomes a reason for stress. What is important at this stage is that the individual not only acquires and rehearses new skills, but also learns to free himself from negative and maladaptive thought patterns and internal monologue or instructions that are negative and that can hamper a constructive coping with stress. The third stage, after the individual has acquired and rehearsed his skills, involves application and follow-through. When the individual actually applies the skills that he has achieved in situations that are simulated. For instance, the psychotherapist may try to discuss possible situations of potential stress and what the individual will do in those situations based on the skills that he has acquired, or even he may simulate conditions and engage in role playing so as to give an opportunity to the individual to actually put the things that he has learned into practice. Stress inoculation training has been found to be effective both independently as also in combination with other techniques in dealing with a host of problems such as anxiety, depression, pain, anger, and the like. Specific efficacy of stress inoculation has been seen in students having high test-taking anxiety as also in players who are recovering from injuries or who face injuries quite often. So in this chapter, we learned about a host of stress management techniques such as relaxation, meditation, biofeedback, physical activity as also stress inoculation training. Some of these techniques may be a bit complex, for instance, biofeedback mechanism, something which we cannot apply in our day-to-day lives. However, certain other techniques such as relaxation or meditation or even physical activity are such that you can use it in your daily lives so as to reduce stress. So what you take back from this lesson is whenever you get stressed, try using these stress management techniques for yourself and also encourage others to use the same.